to officially kick us off. So welcome. I'd like to acknowledge that I am joining from the lands of the Bidjigal people here in southwest Sydney. And I'd like to pay my respects to the elders past and present and acknowledge that I am joining from unceded lands today. Welcome to our webinar, Human Learning Systems in Action, Stories of Transformation. My name is Jess Fuller and I'm a Program Manager from CPI ANZ, and I'm here to be your host this evening. Today we're here to explore what HLS looks like when it's implemented into the real world. And our hope is that you'll leave today with a bit of a shared sense of possibility, that this type of work really is possible in the real world. And we'd also love to start building a bit of a constituency of like-minded folk who really share a desire to be doing something different with government and how we work in government. So in just a moment, I'll speak a little bit about what to expect for the webinar today. But first, I'd like to invite each of our speakers just to briefly introduce themselves and where they're from. So I might ask Toby to speak first. Toby, would you like to introduce yourself?
Thank you, Jess. Good morning from the UK. So I'm coming to you from Whitby Bay in the northeast of England, and I'm for my day job I'm a professor of public management at Manchester Metropolitan University, and I work also for the Centre for Public Impact and for CiviNet Associates, and I'll be sharing a bunch of what we've learned about how to do public management differently with you today.
Thanks, Toby. It's early in the morning for Toby, so thank you for waking up to be here with us on a different time zone. I might get Abby and then Ruth to introduce yourselves, please.
Thanks, Jess, and good afternoon from Brisbane, Australia. My name is Abby Richards. I'm the Program Manager and Implementation Lead for Regional Reform, and I work in one of the central agencies in Queensland Government, the Public Sector Commission.
Hi, my name is Ruth. I work with Abby, so I'm the Director of the Design, Learning and Capability team in the Queensland Public Sector Commission. Our team is responsible for really building capability in contemporary approaches to working, particularly complexity-informed approaches and collaboration. So we've got a few other team members here on the call tonight, so looking forward to the chat.
Thanks, Abby, and thank you, Ruth. I'd now like to invite David and Rowena, if you could both please introduce yourselves as well.
Well, kia ora koutou from Aotearoa in New Zealand. My name's David Hanna. I'm part of the team at Te Heko, which is a community innovation centre under the umbrella of Wesley Community Action and connected to Inspiring Communities. So a space for community to have dreams and try and spark those dreams into sort of some new systems that work for community.
Kia ora, my name's Rowena. My role within Wesley is I'm the National Coordinator for New Zealand People. This is a movement that supports anyone affected from amphetamine. And being in the space of Te Heko, where it's about community innovation, we're in the right space and place. Kia ora.
Thank you, everyone. It's really exciting to have this group of people together today to talk about HLS. I'm particularly excited because we're going to be hearing examples of what HLS looks like in practice in some different contexts as well, in the Queensland context, in the space of a governance model, and in the New Zealand context, in the space of supporting communities. So that's really exciting. Thank you all to our speakers for joining us today. So a quick rundown of what to expect from the webinar. We're going to hear from Toby Lowe first, who will be presenting a little bit about what HLS is and its core principles. We'll then be followed by hearing from Abby and Ruth, and they'll be presenting on the work that they've been doing in Queensland to implement a regional collaborative governance model that's been really inspired and designed based on HLS. And then we'll hear from David and Rowena, who will speak to the work that they've been doing in New Zealand to support their local community. So once we hear from Toby and from a couple of the case studies, we'll then be opening up to the breakout room portion of the webinar. So we'll have 3 breakout rooms and you'll have the choice to join the one of your choosing. So there'll be a room with Toby, a room with Ruth and Abby, and a room with David and Rowena. And those breakout rooms will be a bit of an opportunity for you to have a bit of a deeper Q&A and conversation about the work that they've been doing and that they've presented. We'll then come back and officially close the webinar and move into what we're calling the after party. So if you want to kick on and stay online with us after the webinar closes officially, you're very welcome to stay online. There's no set time of where it ends. We just want to give space for extra conversation and discussion and celebration and partying if that's your jam after we, close the official proceedings. Right, so, and just before we kick off, before I hand to Toby, just a couple of housekeeping things from me and then I'll zip it. So the first is that we've got the Zoom Q&A function open. So down the bottom tab of your screen, there should be a button that says Q&A. You should be able to click on that and ask questions. I'd really encourage you to use that as presenters are speaking. If we have time after each presentation, they might be able to answer 1 or 2 of those questions. Otherwise, it'll be the breakout rooms where there really will be a chance to dive into the questions in the Q&A. You should be able to see the questions that are coming through and sort of vote for the ones that you're interested in responses to as well. So definitely open up that Q&A function. Also feel very welcome to use the chat in any way you see, be it questions, comments. It's really great to... Oh yeah, thanks, Jackie. Yeah, it may be a little bit hidden, but it is there under the more, there's little 3 dots to click on the Q&A function there. Yeah, and use the chat as well. It's always really fun to have an engaged chat with questions and comments coming through there too. We are recording the webinar today and we will be sharing it back with all of you and everyone who registered. So that'll be coming in the next sort of week or so. And just a note on sort of cameras and audio, very welcome to have your cameras on. It's really nice to present to faces, but I'm sure maybe some of you are commuting home at the moment or can't be on camera, so that's also totally fine. Just ask that you keep yourselves on mute so we don't have any background audio distracting everyone. Another thing to note is that a big reason why we're here is to launch the new HLS Insights series of reports, which I'll just drop a link in the chat of those. So everyone, yep. So yeah, we're launching these reports. We'll also send out a link to those to everyone after the webinar too, but they're certainly worth diving into if you're interested in learning more about HLS. And the last thing that I'm going to say is that we do have a HLS group on LinkedIn. And if you're interested in connecting with others and learning more about what HLS looks like in practice and learning from each other, I'd highly encourage you to join that LinkedIn community. We're stronger together when it comes to doing this work. So I will also drop a link to that in the chat and we'll send that out in email. But I think you've heard enough from me. So with that, over to Toby. Take it away, Toby.
Thank you, Jess. Right, let's see whether I can work the sharing function again. Well, share and share. So can everyone see my first slide? Yeah, thank you, Jess. Thank you for spending time to talk with us today. So I'm going to share with you what we've learned from the latest round of action research around human systems and the summary report that as part of the Insight series that Jess mentioned, Human Learning Systems Radical Pragmatism. So, right, so this is a talk about public service and public management, and here's what I mean by those terms. So public service is the work that enables people to create good outcomes in their lives. And public management is then how public service is organised, funded and governed. And the crucial point about that definition is that public service doesn't mean public sector. So public service is undertaken by a wide range of people and organisations who want to create the conditions where everyone can lead thriving lives. And you'll see that recognised in the range of examples that we're going to be sharing with you today. And essentially my job here today is to offer you a choice about how you do public management. And I'm going to argue that that choice is really significant because I think that both the research evidence and our experience tells us that the way we mostly do public management at the moment actively gets in the way of providing effective public service. And so the point is, we can choose to do this different. And in offering you this choice, I really want to offer you hope that things can be better and that we can all play a role in making it so. And so this is the essence of the choice that I want to offer you. That it's a choice about the way we think public service is most effectively organised. So on the one hand, do we liberate people, the citizens and the workers who serve them, and enable them to learn what works in context? Or should we try and control people, the citizens and the workers who serve them, and make them comply with our understanding of best practice? So that's the choice I think we have. And so what are the different public management paradigms which underpin this choice? So behind door number one is human learning system. So this is an approach to public management that talks about the idea of public service for human freedom and flourishing. So human learning systems means liberated and learning citizens who are supported to pursue what matters to them. It means liberated and learning workers who have the freedom to learn what works for each and every person they support. And it means liberated and learning leaders who are creating the conditions for citizens and workers to continuously learn together. And all this adds up to public service which moves from central control to citizen control. So you heard me say the word liberation there. So there's a lot of this that's about kind of autonomy, but what is it that binds us together then in the human learning systems approach? And in human learning systems, it's our relationships which bind us together. So we do the right thing by our neighbours or by George or by Hardeep because we recognise them as another human being with strengths and needs that we can respond to. So human learning systems, because it stems from complexity and systems thinking traditions, uses the language of systems to describe those relationships. But what we mean by a system is just a set of relationships which make something happen in the world. So a system is just a mental model of those relationships, and we create those mental models to identify the relationships we care about in respect of achieving a particular purpose. So that's tool number one. That's the first choice they have. What's tool number two? So I would say that this is public choice theory and new public management. And where does because this gives us the framing around control and comply. So its intellectual origins comes from James Buchanan, who was a libertarian economist in the 60s. And so for those who are interested, I really, really recommend his biography, Democracy in Chains. So he was the first person the Koch brothers invested in as part of what became Project 2025. And his mission was to break the welfare state. Because as a libertarian, he believed that it's illegitimate to tax one person and spend those resources on somebody else. So in order to enact that vision of breaking the welfare state, he created a vision for the state and public service that he called public choice theory. In it, he said, public servants, like everyone else, are selfish. So public servants are selfish. So they can't be trusted to work in the public good. So public servants need to be controlled in order to make them serve the public. And how can public servants be controlled? This is where new public management comes in, which was built on the intellectual foundations of public choice theory. So it says we control public servants to make them do the right thing by setting them targets and by the discipline of the market. So we contract to deliver particular specifications, and we are bound by that contract. So in this worldview, doing the right thing means hitting our targets and living up to the terms of our contracts. So when we live inside this vision of public service, we create a situation in which workers are constantly looking upwards for permission, for budgets, for reassurance that they won't get into trouble for doing something. So when we organise for control like this, then compliance becomes the overriding virtue and capability. So how can we choose between these different public service paradigms? So I think this is partly a values choice. What do you want the world to be like? But I would argue it's also a pragmatic choice. How does the world actually work? So to help us make this choice, we can use the definition of public service we identified earlier. So do we believe that the purpose of public service is to help people create good outcomes in their lives? Because if we do, then how outcomes are created becomes really, really significant. Because knowing that can help us identify which public management paradigm enables that purpose. So let's explore how outcomes are created. This is New Public Management answer. This is New Public Management's answer to that question, how is an outcome created? So it's a program logic model, which many of you will be really familiar with. And so what this represents is a linear, disaggregated process by which organisations or programs deliver outcomes. So it starts with a set of input resources, people and things. They undertake program activity, which creates outputs, which creates outcomes. So it's a linear process by which outcomes are delivered. This is the alternative. This is a complex systems framing. So this is a systems map of obesity produced by the UK Government Office for Science in 2007. So it suggests that there are 108 different factors which combine to create the outcome of obesity or its absence, and they can be summed up into areas like people's early life experiences, how food production and supply works, macroeconomic drivers, education, media, technology, the nature of work, built environment, and down there in the bottom right-hand corner of that systems map, you'll see healthcare and treatment options. And so under this perspective, it is this whole system, all of these relationships operating interdependently, that's what creates the outcome of obesity or its absence. So, first question I want to ask you today, which framing is a more accurate representation of the processes by which outcomes are created in the world? The answer, you put your answer in the chat if you like. But I would argue that the answer to this question is really important, because if outcomes are made from linear disaggregated processes like New Public Management wants to says, then we maybe should control people if what we really care about is outcomes. Because if outcomes are made like this, like the top left, then we can use evidence to find best practice, and we can make workers and citizens comply with that best practice by setting performance targets which embody those practices and by sanctioning citizens to make them behave in desirable ways. We can purchase outcomes by specifying what we want and by putting those specifications out to tender, and we can hold organisations to account for delivering on those specifications if we believe that outcomes are simple linear processes like the top left. But if outcomes are created by complex systems, then we can't do any of those things. Because if an outcome is made by a complex system, then it's created by hundreds of different factors acting interdependently and unpredictably. And most of those factors aren't anything to do with public service. So what works for one person won't necessarily work for another, and what works for one point in time won't necessarily work if we try it again. We can't, if the bottom right-hand picture is more accurate, then we can't fund organisations to deliver outcomes because those organisations aren't in control of the factors by which outcomes are made. So if outcomes are complex, we can't control people to create good outcomes. We need to enable them to explore and learn for themselves what works uniquely in their context. Question number 2 to help us find this choice. Who gets to decide what counts as a good outcome? So, top left again, do some people get to decide on behalf of others? So the little person to the left of the group, do they get to decide on behalf of that other group? Because if some get to decide on behalf of others what counts as a good outcome, then we can set standardized outcome targets which will apply to everyone. And we could use those standardized metrics to benchmark between teams or places and reward or punish them based on who achieves them best. But if each person gets to decide for themselves what matters to them, we can't use standardized metrics to judge performance, because what counts as good will be unique in each and every case. So this is how I think we can frame our choice about which public management paradigm we want to use. If outcomes are simple and deliverable, and it's okay for one set of people to decide what those outcomes are on behalf of others, then let's control people and make them comply with best practice. But if outcomes are complex and it matters that each person gets to decide for themselves what a good outcome is, then the most effective organisational strategy is to liberate people and to enable them to learn together. So this is the essence of our choice. And to confirm these hypotheses, I think we can check in with the evidence. So what happens if outcomes are complex, but we choose to manage by control? So this is essentially the natural experiment we've been running for the last 40 years, because over the last 40 years, we've created this managerialist fantasy based on the idea that human flourishing is simple and that we can control public servants effectively to get it. So we've broken human flourishing down into discrete public services. So this one service will help you find a job. This one will help you be a better parent. This one will help you if your mind is sick. This one will help you if this bit of your body is sick. And in this disaggregated managerialist fantasy, we pretend that if each service follows pathway A reliably enough, consistently enough, with enough fidelity to the model, then what we'll get is outcome B. And it would be great if this was true, but it's not. It's pretend. And it's pretending to make the task of management easier. It's got nothing to do with the complex reality of people's lives. How do we know this? So, meet Brian. A while back, so this is a real case, but obviously a pseudonym. A while back, Brian was a train driver, and then someone jumped in front of his train, and his life went into a bit of a spiral. So he developed mental health problems, he had substance misuse problems, he lost his home, he lost his relationships. So the type of kind of cascade of troubles that anyone's life can experience. And he ended up as the most frequent attender in accident emergency in the town of Gateshead in 2022. And for those who don't know the northeast of England, Gateshead is a town up here where we are. Then a programme called Changing Futures Northumbria began to work with Brian. And because Changing Futures Northumbria worked relationally, they asked Brian about his history of interaction with public services. And this is the story that Brian told. So from the story, they were able to map Brian's public service interaction over the past 10 years. So each of these little yellow and orange bubbles is a contact with public service. So every time Brian attended accident emergency or saw his drug and alcohol worker or was arrested, every single one of those contacts with Brian is recorded on this chart. And so for the first time, we can see all of the interactions of a person across all of these different public services. And all for Brian, so because we were able to see the detail of Brian's case, because we got the data sharing agreements from all of these different public services, we know with precise detail all of Brian's contacts with public services. So there were over 3,300 contacts with public service. These are just the ones that are known, so there's bound to be more. And we can put a precise cost on each of those interactions. And that means we can work out exactly how much public service resource use Brian had over the last 10 years. And that added up to nearly £2 million. So nearly £2 million we spent supporting Brian. And if that was helping Brian, that's exactly what he needed. That would be money really, really well spent. But all of those interactions weren't helping. He says his life is getting worse, not better. So by 2022, he couldn't maintain a tenancy. His substance misuse problems were serious and getting worse. He was in accident emergency between 50 and 100 times over 2022. And you can see his year-on-year resources is needing more and more and more help, and it's still not actually helping. So he's using more and more public service, and his life is getting worse. So the best we can say is we're just about keeping Brian alive, but as he said himself, that wouldn't have been for long. And so we spent £2 million not helping Brian. But every one of those services was doing exactly what it was supposed to do according to new public management. Every single one of those services was compliant, and none of those compliant with its service specifications, and none of those workers were doing anything wrong according to their targets. In fact, some of those services were in fact rated excellent by the inspections. So it's not just the particular experience of citizens that shows us that seeking to control via targets fails. The management research evidence tells us that seeking to control via targets leads to routine attending. So this is just one of the pieces of evidence that should see us really bury new public management, but it's a really, really significant piece of evidence. So it's a systematic review of all the research studies into the use of target-based performance management across public, private and voluntary sectors for the last 40 years. What did it find? It found that over 80% of studies find evidence of gaming, so the deliberate manipulation of data to make it look good. Nearly 3/4 of those studies find evidence of people deliberately lying. I think it's really important that we stop and take a minute to appreciate the significance of this evidence. Because if we use targets to manage our services, it means we can't trust the performance data that it's produced. It's likely to have been gamed. So, and it may be that your cognitive dissonance kicks in hard at this point. You're saying to yourself, that can't be true of my service, but try and fight back against that cognitive dissonance. Think of all the ways in which the work of the people that you do is shaped to produce good-looking, compliant data, rather than serving real strengths and needs of people like Brian. Because this is the cost of all of that pretending. We're not helping Brian. And maddeningly, we're wasting huge amounts of scarce resource not helping Brian. So £2 million to make his life worse. And we're making it much harder to learn and improve. Because if we can't trust our data, we're not telling the truth to each other. And if we're not telling the truth to each other, how does any of this get any better? Perhaps most insidiously, it means we're undermining public trust in government and public service. Because when performance data doesn't match people's own experience of public service, citizens feel that misalignment deeply. And that misalignment undermines trust, and it fosters the conditions in which extremism thrives. So, let's choose to embrace the complex reality of how outcomes are actually made. And so as part of that, I think we can learn from those who've been experimenting with doing public management differently. So that's partly the purpose of us sharing the examples you'll hear later with you today. So what I can share with you today is learning from those who have made this different choice. So there are 72 organisations and places around the world have been exploring how to do public management differently, this human learning systems approach. And between them, they've written over 80 case studies of their work. Actually, there are more than this. They're just a bunch of people who haven't written up and shared their work yet. And this is one of the headlines from what we've learned from all of that work. That people are reorganising each of these public management areas around learning. So they're organising the public-facing practice around learning, operational management around learning, leadership around learning. You get the idea. And we've learned that making these changes together becomes sustainable. So it is by making all of these changes together that creates paradigm shift. So when you make all of these changes all together, all learning relationships become at the core of each of these areas of management practice. And so change in all of these areas is required to make sustainable, sticky change. And that sounds like a huge challenge, right? You've got to make change in all of these areas. But the great news is you can start anywhere. You don't have to make all of these changes all at once. You can start somewhere and go everywhere. And you can make a bunch of these changes tomorrow. So if you're a public-facing worker, you can have different conversations with the people you serve tomorrow. If you're a team leader, you can organise your team meetings as learning tomorrow. So what I'll do now is I'll take you through each of these headline areas in turn to explore how people are organising for learning in each of these areas. So firstly, the public-facing work. These are the principles of that. So essentially that citizens get to determine for themselves what counts as good outcomes. And what this means is this requires relational working so that workers and citizens can understand each other's strengths and needs together. And what enables this is bespoke provision. So public service that can respond to the unique strengths and needs of each person. What does this look like? It means continuous collaborative experimentation and learning is the public-facing work. So it means that every act of public service is an act of shared action research between worker and citizen, or between citizens. Let's basically say, let's explore together what works for you, because this is how real outcomes are made. So the role of public-facing workers can be framed by this kind of learning cycle. This is the pattern we've seen. So let's say I'm a public-facing worker with responsibility to help you with your chronic pain. So my first task is to help us both understand your life as a complex system that is currently producing the outcome of chronic pain. So to understand your life as a system, I might ask you questions like, what was going on for you when the pain started? And can you tell me more? Can you tell me about the days when you notice your pain more? And together we'll build up a picture of your life as a system which creating this experience of chronic pain. And then together we'll explore what actions we should take to see if we can create a version of your life as a system where your pain is more manageable, where you're having a more fulfilling life. So we might design a set of experiments or explorations to try together that says, what happens if we try this physiotherapy technique? What happens if you try this pain medication? What happens if you try joining this walking group, etc., etc., etc.? And we'll treat each of those pieces of action research. We'll treat each of those acts as pieces of action research. We'll decide what data we need to capture to understand how those actions are going, and we'll make sense of that data together. And we'll do those experiments and explorations, and from what works and what doesn't, we'll embed behavioural and structural change around your life, and we'll share that learning with whoever needs to be influenced with it. And that changes your life as a system, so the cycle starts again. So if workers are constantly experimenting and exploring, they can't be controlled by output or outcome targets, because they have to be free to explore what works for each person that they serve. So what do managers do if they're not setting targets and monitoring performance in that way? What they do is they organise the capacity to learn and improve. We call this learning as a management strategy. So it changes the purpose and focus of management so that organising for continuous collaborative learning becomes the primary role of managers. And this happens at multiple scales, in the public-facing work, at team scale, at organisational scale, place scale, and at country scale. So at every level, the purpose and focus of management changes. And what happens is that managers are connecting learning cycles across different system scales. So let's say that I'm a team leader supporting a team of workers who are helping people with their chronic pain. So let's say I, as a team leader, have 10 workers who are each seeing 10 citizens at any one time. So what that means is that there are 100 learning cycles that my team are running simultaneously. So that's the bottom scale of the diagram that's in front of you. So my primary job as a team leader, that's the learning cycle at the top there, is to create a learning environment, the processes and culture by which we can learn from the 100 learning cycles that are happening in the work. So our team meetings become debrief sessions in which we share what's happening with our learning cycles. And in those debrief sessions, we can ask, what are the patterns of need that we're seeing from all of these experimentation in the work? What is our practice? What are we doing that responds to those strengths and needs? How is our practice working? And from the answers to those questions, we can ask questions like, okay, then what are the staff capabilities that we need to recruit and train for? how should we organise ourselves in order to enable that practice to work most effectively? And those questions inspire the learning cycles that I create as a team leader. So experimenting with how to organise the work differently in response to the constant challenges to business as usual, which arise from the work. And in doing so, the experiments with how to organise ourselves differently create enabling conditions for them. So if that's what public-facing workers and operational managers are doing, what are leaders doing in order to continue to support this processes of continuous collaborative action research? What they're doing is looking after the health of systems which create or frustrate the outcomes we seek, to enable those systems to learn well. And so I don't mean here just leaders with seniority positions. This is anyone who has a kind of leadership responsibility. So what we describe what they're doing as system stewardship. So system stewardship is the act of convening people or organisations to create a system of interest, and then stewarding those people and organisations so that they can understand themselves as a whole system and see the relationships which create or frustrate that purpose. And then and by seeing those relationships, those people and organisations are able to collaboratively change how those relationships operate. So the learning cycle is just a process by which to achieve those. So the learning cycle is a quasi-process map by which stewards can create healthy systems. And those are the characteristics of we think of a healthy system.
Oh, I want this. Somebody pay attention.
And to create those healthy systems, the people and organisations must be funded to continuously experiment and learn. So a key part of this change is changing how the money works. So what this looks like is funding for continuous collaborative experimentation and learning. So it's funding to enable learning cycles. So one example of this in practice is from the Swedish International Development Agency. They contracted with an organisation called Climate Kit to create the Systems Innovation and Experimentation Fund, which they built around a learning cycle. So they had their grant application process. It tested the work the applicants had done to understand the systems they wanted to change. And then they supported actors in those systems to develop action research activity to explore the actions to create change. And then they funded those as pieces of action research. So they weren't funding the delivery of programs, they were funding organisations to experiment and learn collaboratively in their context. Because remember, that's how outcomes are made. And those processes, that funding process, are really similar to a bunch of ones developed by UK public service commissioners at local scales. So all of these places and organisations listed here have funded so as to enable organisations to experiment and learn together. That's the primary purpose of the funding. Because if we don't fund for learning, we don't create healthy systems and we don't get the outcomes we desire. So if you're a funder, remember, if you try and fund for results, or if you're trying to fund to purchase outcomes, you don't get real outcomes. You get a bunch of gained data, corrupted data. So this is a really simple choice for funders. Do you want to fund in a way which supports the creation of real outcomes, or do you want a bunch of good-looking outcome or impact data? And you have to choose that. You have to choose. Because as soon as you try and fund to purchase results, the data will likely be corrupted. Remember, that's what the evidence says. And the great thing if you're a funder is that this is a choice that any funder gets to make. It's entirely in your gift whether you want to fund it in a way that enables the learning that enables real outcomes to be made. And if we work, manage, lead, and allocate resources for learning, we also need to govern for learning. So people are changing how governance and accountability work. You'll hear from some of those folks in just a minute. And so people are seeking to govern the health of the system. And the governance question they ask is, does it have good learning processes and relationships? So, and alongside this, they're changing how accountability works. So they're making accountability for the appropriateness and the rigor of learning, and they're asking for accountability around how people adapt from their learning. They're also changing who workers are accountable to. So they're asking workers to account to citizens and peers, as well as up the hierarchy. And they're changing how those accounts are made So it's more about providing an account using mixed methods. It's not just about counting. Because when we change how governance and accountability works, this is the final piece of the puzzle that unlocks and makes sustainable all of these other kind of practice changes. And if learning becomes the work, then evaluation has to serve a different purpose. So essentially, when learning is everyone's job every day, learning isn't a separate specialist function that's just done by evaluators. So evaluation becomes evaluative practice. And the question that evaluation asks is, how can we support learning in the work every day? Final point about evaluation, about kind of learning, I want to say is about the importance of data and learning. Because some people hear the critique that we offer of targets and say that human learning systems doesn't value data or measurement. I'm really, really happy to correct that misunderstanding. Because data is more important to a human learning systems approach, not less. So what human learning systems does is it breaks the link between data and targets. Because as we've seen, targets corrupt data. They prevent data from doing its job. And we've known this since the 1970s. So this is from Charles Goodhart, who was president of the Bank of England in the UK. When a measure becomes a target, it ceases to be a good measure. So we can break that link between data and targets and enable data to do its job at supporting learning cycles. So data helps actors to understand their systems, and it helps to capture how action research is going. Finally, so that's kind of a top level run through what we have learned about how organisations are doing things differently. The ultimate pragmatic question is, what does all of this cost? So let's check back in with Brian. So when Changing Futures Northumbria started working in a way that supported human freedom and flourishing, two things happened. Firstly, Brian's life dramatically improved. So he has his own place. He's not just attending Alcoholics Anonymous meetings, he's now chairing them, and he has a job. And because his life is getting better, his public service resource consumption has plummeted. So it's gone from over £460,000 a year in 2022 to, in the space of 18 months, less than £2,000 per year. So he's now using 0.3% of the resource that he was in 2022. And the Changing Futures Northumbria evaluation identified that they were creating an average cost saving of £50,000 per citizen per year. And that £50,000 per citizen per year figure is a really interesting figure, because it exactly matches Thurek's experience of working in a really similar way with a similar set of citizens, those with quote unquote multiple and complex needs. So these are the results of Thurek's complex housing intervention programme, an average cost saving of £50,000 per citizen per year. And they managed a total of £1 million worth of cost avoidance for the programme as a whole by working in this relational way that I was talking about. And if you multiply, so let's get some national cost savings figures from that. So I only have figures for the UK, unfortunately, but if we multiply the cost saving figure, £50,000 per person per year, by all the people in England with quote unquote multiple and complex needs, according to the UK government figures, we get a annual cost saving of £18 billion. And the equivalent figure for Scotland is £1.4 billion. And if we look at the figures for people with any complex challenge, so those are figures for people with all of the complexities of homelessness, substance use, involvement in the criminal justice system and mental health problems, we look at people with any of those four problems, then the equivalent cost saving figure is £37 billion per year. So this is what we can save simply by choosing to do public management differently. And note, that doesn't include any of the longer term savings from preventing people from developing those biggest, most complex problems. This is the immediate cost saving we can generate right now just by doing public management differently. So this is why human learning systems assert that the purpose of public service is human freedom and flourishing. Because this represents and manifests a set of values in the world. It's what we believe is important about the world. And we think it's more important to stand up for human freedom and flourishing right now when the world is becoming more authoritarian. So we think it's time for this kind of radicalism and boldness. And the fantastic thing about these values is that they're also fundamentally pragmatic. So liberated people, connected in learning relationships, is what enables us to create good outcomes in the complex reality of the world. And in doing so, we can save enormous amounts of public service resource when these are tight. So this is a choice we all get to make, and we can start tomorrow. So if you're curious about doing this more, you can download the Insights series reports. You can check out the examples of practice, which might inspire with you and connect with those folks. You can begin to experiment with working in this way. So there's a free practical guide commissioned by Healthcare Improvement Scotland. Download it, get cracking. And if you feel like your organisation needs help with this exploration, you can ask for help from a learning partner. So there's lots of people and organisations in the Human Learning Systems Collaborative that can help, and my colleagues in the Centre for Public Impact at ANZ, they are expert learning partners who can really help with this stuff. And finally, if you'd like, you can get in touch with me. I'd love to hear what you're up to. Thanks very much. Hope that was interesting in some kind of way.
Thanks, Toby. I love the truth bombs. There's a lot of reaction in the chat as well. Thank you so much for that. I'd love to hear some questions, but I also want to keep us in time. So I think we'll hand over to Abby and Ruth now, who are going to share their experience with implementing a regional collaborative governance model using HLS. So I think with that, over to Abby and Ruth.
Thanks, Jess, and thank you so much, Toby. Lovely to see you wake up with the passion that you that comes upon you when you're talking about the HLS work. Very early in the morning for Toby over there. But thanks everyone for joining. We're delighted to have the opportunity to have a talk with you about the model and how it's leveraged HLS over time. Obviously, well, maybe not obviously yet, but this work is happening at quite a different scale, a little bit further away from the experience of citizens. So I wanted to start by outlining the drivers for the work so we can start to build those connections through the presentation. So if you could jump to the next slide, please, Jess. Thank you. So some of you may not know, Queensland is about the same size as Saudi Arabia. So an enormous state for a state government to govern. Decision-making power, like the population, is very much concentrated in one little corner. So 2/3 of the population are in the southeast corner of the state, as is the seat of Queensland government. So the distance and sometimes remoteness of communities from Brisbane make it very difficult to generate support for effective regional action. So in that way, I guess our regional communities are like the Brian of this story, in that often things are happening to them, but then they're not so involved in the processes where decisions are being made from far away. At the same time, communities, like communities everywhere, are dealing with some really incredibly complex challenges that just cannot be addressed by any one government agency working alone. It doesn't matter how closely that agency might be working with community and citizens. That would be an example of that disaggregated managerialist fantasy that Toby was talking about. And it's not to say that agencies in the regions don't work collaboratively already. They certainly do. And that is absolutely critical, particularly in supporting Queensland's disaster responses, which have to be activated much more frequently than we would like. But they do experience a whole range of barriers to being able to jointly respond effectively to emerging priorities in their communities. And that causes significant frustration, both for the public servants themselves, but especially for the communities that they're working with, and also the communities that they are part of. Go to the next slide, please, Jess. So in 2021, the Public Sector Commission, where we work, was invited to convene a series of discovery workshops and process discussions with regional leaders to really deeply understand the barriers and challenges they were facing, which led to the development of a discussion paper that was presented to our leadership board, which is essentially a committee of the chief executives of the ministerial portfolio departments, and it's the highest decision-making body in our state government. So that leadership board then endorsed us to progressing to a detailed design phase to look at developing a model of collaborative governance to support the regions. So that design phase ran over about 3 months, and a detailed prototype of the model was then presented back to that leadership board after that period. And from there, we were given approval to progress to implementation. And to resource the model as a demonstration for that shared need for better collaboration across agencies, there were 14 full-time equivalent positions, which were co-contributed by a range of different agencies across the sector. So these were permanent FTEs that were relinquished by agencies and contributed to the model to make sure that the model was authentically shared across the system. And that's the first time that that had happened in Queensland Government. Go to the next slide, please, Jess. So the implementation program was a pretty complex piece of work. So it involved recruiting and onboarding new teams with those 14 new staff plus some extras. There was the establishment of new entities and then the development of the rhythms within and between those entities as well as designing and delivering capability development activities to look at what was needed skills-wise to support the model's functioning. There was so many moving parts. So implementation had to be undertaken really iteratively and had to be done carefully and in collaboration with the key stakeholders. That took about 18 months, and eventually the model was fully implemented in December last year. So through the design and implementation process, there were approximately 150 hours of workshopping with more than 50 stakeholders across the system, representing more than 10 agencies. We've spent a lot of time briefing, so more than 60 hours briefing executives and about half that time briefing agencies throughout. Thanks, Jess. So what is the model, you might ask? What am I going on about? So it's a governance model, as Toby has alluded to. It's not a delivery model. It's really been designed to enable collaborative action, and it pulls together a collection of cross-agency entities. So we're going to show you a short animation that describes it, but essentially we think about it as a network of purposefully formed relationships. And that's really designed to establish pathways for government to understand and respond to regional cross-agency challenges and opportunities, to strengthen collaboration across those agencies, balance that statewide and local action more effectively. It seeks to create ongoing capacity for learning and collective action as a fundamental component. And it also is about building regional leadership capacity and capability. So we'll have a quick look at the animation, just goes for a couple of minutes, and then Abby's going to take over and speak to you about where HLS comes in. Thanks, Jess.
For years, government has grappled with the best way to solve the complex challenges facing Queensland's unique and diverse regional areas. To address this, the Queensland Government has established the Regional Collaborative Governance Model, an innovative approach to improve cross-agency collaboration and communication to deliver better outcomes for regional Queensland. Under this new governance structure, cross-agency entities have been established to work collaboratively to identify regional challenges and opportunities and provide government with actions to meet the needs of the regions. At the core of the model are the regional leadership networks. These networks bring together senior officers from across Queensland government agencies to identify and collaborate on regional priorities. There are 6 regional leadership networks, or RLNs, across Queensland. The RLNs work to identify issues and challenges within their region using their diverse perspectives from across government, drawing on their collective knowledge, community intelligence and other data sources. This information is collated into an annual work plan. Each RLN implements their annual work plan with the support of a dedicated regional collaboration officer. The model includes groups of government representatives that work together to support and enable RLNs to progress projects in their annual work plan. The Regional Policy Coordination Team supports the work of the regional leadership networks by undertaking research, understanding the whole of government policy environment, and creating strategic clarity. A key component within the model is a Regional Leadership Alliance. Membership of the Alliance includes the chairs of the RLNs, supported by key stakeholders who can provide value to the deliberative process. The Alliance receives and analyses input from across the regional leadership networks to identify shared priorities across regions and provide direction on overcoming barriers to collaboration. A subcommittee of the Leadership Board, the DDG Regional Stewardship Group, has members from agencies across government. Their role is to provide whole-of-government insights into decision-making and promote a culture of collaboration. The group provides support in undertaking cross-government problem-solving, addressing barriers to collaboration, and supporting development of regional leadership. Ultimately, the Regional Collaborative Governance Model establishes a new way of working between agencies to achieve better outcomes for regional Queensland.
Thanks, Jess. We might go to the next slide now. Okay, so let's dive into more about HLS and how it influenced the design and thinking around the Regional Collaborative Governance Model. Firstly, the human element of HLS. As you saw in the animation, the model places regional voice at the centre. It recognises that those public servants who are closest to regional communities are best placed to understand local issues and opportunities, and further that leveraging their intelligence and know-how is really the key to developing truly responsive public policy and programming. So in this way, the human element of the HLS approach really provided the why or the purpose behind the model to elevate the intelligence of those public servants in regions, or to use Toby's language, what we're talking about is the liberation of those public servants in regions. The model intentionally disrupts vertical and horizontal relationship barriers. Its design creates deliberate interactions across hierarchical boundaries and across agencies to support new relationships to form. But more than just simply creating the conditions for relationships to develop, the model actually utilises specific meeting dynamics to foster and nurture relationships. So all entities across the model operate and interact in workshop-style formats. And while agendas and minutes are still used in meetings, the meetings themselves are designed to be highly interactive, elicit diverse perspectives, and really challenge assumptions. So by treating relationships and humans as a critical resource, the model has leveraged the human key principle in HLS, identifying interpersonal connections as an essential element for its success. Next slide, Jess, please. Thank you. So the learning element of HLS heavily influenced the design of the model. In complex systems and environments like governments, which are really characterised by a variety of interactions and complicated interconnections, it's not possible to specify what good looks like in advance. And as we saw in Toby's presentation, we can't use a linear program logic to predict what the end goal might be. Instead, what we must do is acknowledge the complexity of the system we're working within and adjust our approach. So in our case, continuous learning became a real critical practice. The Centre for Public Impact was engaged as a learning partner to work closely alongside us throughout the implementation process. And this ensured that implementation progressed with an eye to what was emerging and allowed then responsive action to be taken in rapid real time where required. And then these learning practices are now being carried into the ongoing operation of the model. These learning practices will allow us to continue to adapt, iterate, and improve as the model matures. We've also developed a 3-year measurement, evaluation, and learning plan, which details learning practices that will be utilised across the model and how they will improve performance in an ongoing way. We'll talk you through that a bit more shortly. Next slide, please, Jess. And lastly, the systems element of HLS. The system of influence, system of interest, at the outset of this work was those parts of government that have a role in influencing outcomes for regional communities, especially in relation to complex and sticky problems. This system, though, is complex, it's multi-layered, and it hadn't previously been intentionally boundaried, nor had the relationships and interconnections between those various layers been attended to. So the HLS learning stack, you can see an image here on the screen, and where you can't see the detail of it, what you can see is that it really aided our thinking around the different scales of the system that we would need to define and then connect as we designed the model. So through the design process, those entities whose role it would be to support and connect these various scales were designed, and mechanisms for scaling learning within and between them were also developed. And as Toby mentioned, when we talk about the model, we often use the term systems stewardship. It acknowledges the complexity and interconnectedness of the system in which the public sector operates. Government so often approaches service delivery in a siloed manner, treating issues and challenges as if they were separate or distinct when that's simply not the case. So the model really seeks to cut across that mindset, creating a structure that at its core assumes complexity in all issues and opportunities, and really leverages a non-hierarchical approach to responding to regional issues. And each entity within the model then plays a role in system stewardship, whether at a regional or a statewide level. I'll hand back to Ruth now.
You're on mute.
Sorry, on mute. Thank you. Thanks, Jess, and thanks, Abby. As Abby mentioned, we had a measurement, evaluation, and learning plan with the help of our partners, our learning partners at CPI. They worked with us and key stakeholders across the model to co-develop the MEL plan. So you can see there that we are headed towards this directional goal. This is our North Star, that the Queensland public sector effectively collaborates across agency boundaries to address complex challenges and strengthen regional community outcomes. Beneath that, then we have 4 key outcome areas that we are travelling towards. So if we can show that we achieve these, or we're on our way to achieving these, then we know that we're heading towards that directional goal. So one being that all entities in the model have the capability and capacity to work collaboratively on complex issues. So we have a stream of work that is concerned with that. That agencies are collaborating effectively to act on shared regional issues. That there are reduced systemic barriers enabling seamless collaboration, and that the collective voice and shared experience of regions informs policy and program development. So that's what the model is aiming to achieve. And then beneath that, we have these learning streams. And within those learning streams, we have a suite of learning and accountability questions that will enable us to track progress toward those outcomes. And we've got a range of methods, mixed methods, to gather data. Biannually, we'll bring together stakeholders from across the model who will come together and collectively make sense of that data to determine what adaptations might be appropriate in response. So this is not about an evaluation to understand whether something worked at the end. It's very much a process to help us to learn along the way, and the actual the work of doing that sort of measuring and learning throughout the time of the model over the next few years actually sits with different entities and stakeholders within the model, so it supports those learning practices across the whole thing. Thanks, Abby. Back over to you.
Thanks, Ruth. A couple of slides left here. So we're just going to talk through some of the key learnings. So over the last couple of years, even longer than that, some of the things we've learned throughout the design and implementation of the model. So the first one being that building strong relationships, as you will all appreciate, is crucial for the success of collaborative efforts like the model. It really requires intentional time and resources to foster trust, psychological safety, and a supportive environment. So through meaningful engagement and a real focus on team dynamics, these relationships have created the environment where collaboration and a learning mindset could really thrive. Secondly, ongoing learning and experimentation is really what allows the model to succeed, to navigate complex systems and drive continuous improvement. An environment which encourages adaptability and acknowledges complexity is critical for progress. Thirdly, that traditional government structures can impede collaborative work due to silos and a hierarchical culture. Yet open communication and cultivating stewardship across agencies can transform some of those challenges into collective responsibility. It does take quite a lot of time to do that communication and stewardship cultivation piece, though. For strong leadership, advocacy and champions are really vital in maintaining momentum and driving change. We experienced some challenges throughout implementation, such as leadership transitions, and it became very obvious to us that effective sponsorship is so incredibly important. It drives the continuity of the work and heavily influences the overall success of complex initiatives like this one. Number 5, placing regional voices at the heart of decision-making processes ensures trust, engagement, and most importantly, fit for purpose and tailored solutions. So a real commitment to co-design and amplifying local expertise proved really essential for us and for the model's responsiveness. And lastly, creating a shared understanding and engagement amongst stakeholders was fostered through clear, consistent communication, and rebriefing often was necessary. We used varied formats and language that really emphasized learning and adaptation, and that enabled us to set realistic expectations about what it takes and how much time it takes to implement a complex governance model. So just to summarize, the regional collaborative governance model, it's a formalised structure for enhancing collaboration across the Queensland Government, and it really aims to solve that challenge of collaboration between agencies to address regional issues. It doesn't replace individual agency efforts or set priorities from the top down. It really works through different levels of stewardship and entities to foster joint action. The HLS approach was used throughout both the design and implementation of the model, really emphasising local intelligence and the experience of regional public servants and the communities that they work with. We focused heavily on continual adaptation, experimentation and evolution as new insights emerged, and staying cognizant of the complexity and ever-changing nature of the system that we work within. The model is still very much in its infancy and will continue to adjust and iterate how it operates as we evaluate its effectiveness as it matures over time. Thanks, Jess.
Thank you both. Really amazing to hear the work that you've done. I've had the privilege of having a bit of an insight into the work of Abby and Ruth over the past 14 or so months. And it's been really amazing to see how the experimentation that you've been doing has really evolved into such an amazing model. So with that, I think it's time to hand to David and Rowena to present on their case study with Te Hiko. So I will hand across to both of you.
Ngā mihi nui kia koutou. If we could have the first slide, Jess. Ka pai. Ke te mihi ki te mana whenua, tangata whenua o tēnei rohi Ngāti Toa Rangatira. I just want to start our presentation just by acknowledging the local iwi from the whenua, the place we are here, Ngāti Toa Rangatira. I also want to acknowledge the public servants, local government and central government from New Zealand that have joined this webinar. And I just want to acknowledge some of the challenges in the current environment, the political environment. And I think I'm really appreciative of you joining this webinar about human learning systems, because in many respects at the moment, it feels like the system's not open to that approach, but I'm really hopeful that a network of people starts sharing and learning about how we give effect to this approach. So I'm going to say a little bit about. There's a thing on my screen just that says Portuguese. I don't know if I need to translate from Portuguese. I think I'm speaking English, but
it's English for me, David.
Okay, that's good. That's good. I'm going to say a little bit overall about the Te Heko, and then Rowena's going to talk about one of the initiatives within Te Heko, and that, so that we'll sort of get a bit of an overview. So that's a picture of the team at Te Heko at their gathering at the end of last year. A really diverse group of sort of local residents that are committed to fostering and creating change within the local community that sustains wellness and just good energy within the local community. So it's about a Centre for Community Innovation. So next slide. Thanks, Jess. So, I mean, just the catalyst for forming Te Heko was a conversation in this room where we're sitting with the board of the organisation that asked questions, an inquiry about increasing demand in our food bank. And that conversation and that curiosity and inquiry triggered a whole journey of learning and then some unlearning. And that learning was about the role of high interest debt and various other things that were happening in the local economy that got people locked into a sort of a dependency model on needing food parcels and all that. So that was really the catalyst to say we need to be part of creating new systems that use the expertise of the local community to say, how could we do things differently in that? So that was the catalyst that we said we need to sort of reform and create space for that to happen, which was the birth of Te Heko. And it was interesting, Toby, when we were listening to your presentation, Rowena and I were sitting here nodding our heads because so much of what you were saying, we were going, oh, yeah, we can relate to that. Yeah, that clicks. So
very much so.
And likewise, Abby and Ruth, with your presentation in Queensland, even though we're talking different scale, different types of organisations, there's a lot of commonality in the dynamics and the processes and the approaches that we're applying. So we're a small community-based initiative within one smallish town that's sort of on the edge of Wellington. And so although we're operating at different scale, there's a real lot of similarity. We just go to the next slide, and I'm just going to go and cancel this thing that's annoying me. I'm just going to, here we are. There we are, that's better. There's a pop-up on my screen, so I deleted that. So in terms of just in terms of overview, under Te Heko, there's a whole range of initiatives that are just flourishing. And the interesting thing is none of these came out of a strategic planning process. There wasn't sort of a management-led sort of exercise. They more just bubbled up out of conversations with people in the community. And in that sense, they're quite emergent. And if I just touch on them, there's a whole co-learning process around financial stability and well-being. And that's the Good Sense Initiative, which there's a case study we've written for HLS. There's out of that's grown a local community, what we've called a wealth pool, which is a group of people who save together and loan together at zero interest. So they're creating their own sort of local financial system. Because most of these people in this group have very low income. So the concept of savings and being able to loan to each other at no interest is a very radical and new and exciting evolution. There's an initiative in here which is around reforesting and restoring the quality of the water, where local residents, and just recently they had a gathering in a local park where they were doing sort of assessing what the life was like in the streams and measuring it and recording it and really just connecting with the local environment and looking at how to sort of lift that. So ecological. There's NZ People, which Rowena is going to talk about, which is the whole dynamic of addictions, and particularly about meths addictions in communities, that there's sort of clinical responses in that, but they don't always hit the mark with some members of the communities who, for a whole range of reasons, don't access those services. And I think, Toby, your presentation spoke to some of that. There's a whole range of initiatives around food resilience, where we've got now some hubs in the local community which are composting, we're growing seedlings, we've had a fruit and veggie cooperative, and we want to scale that up to sort of build food resiliency in the local community. So it's small and it's starting small, but it's got really exciting energy, and local people are really active in sort of the developing, the co-designing, and the relearning. And the last one I'll just mention is what we call club whānau, but in New Zealand the term often used is gangs. So there's some particular challenges in terms of how a lot of the population perceive these groups. And there's some initiatives under Te Hiko which are sort of pro-social that support people within those communities to sort of go on a positive pathway, and which basically means that they don't want their children to go into jail and follow the pathway that they've done. So there's a range of initiatives that happen under Te Hiko. Next slide. So you will see I am just basically mirroring the similar slides to what was shared about Queensland. And I've only had to change a few key words to shift it from Te Hiko to the collaborative government model in Queensland. So under the human aspect, that's a photo of people who are connected to Hiko and contribute in all different ways. These are local residents, young, old, diverse ethnic groups who come together and are part of creating these initiatives and supporting them. And it's really fundamental that we sort of see each of these members having knowledge, skills, expertise, and passions that we want to actually create a safe space for them to be able to articulate and say that. And it's fair to say that sometimes the old model or the dominant model of government sometimes sees these problems, these people, as more as problems than as really active citizens in their local community. So, I mean, obviously central and a common theme, it's about relationships and strengthening the relationships. Next slide, Jess. So in terms of learning, that's absolutely critical to Te Hiko if we're about innovation. So we've developed a tool we call a snapshot evaluation, where at regular intervals, every initiative pauses and just sits down and notices what's happening, what's changed, what's different. And then we reflect on what we're noticing. And then each of the team, we do cross-learning across the range of initiatives. So we're consistently trying to sort of use learning to inform what we do. And then at 6 months intervals, we have a wider learning forum, which that's a photo of that group. And in that group there, you've got a professor of economics, associate professor of geography, community members, local government managers, we get a community organisation leaders, we get a sort of a slice of actors and stakeholders, and together we try and make sense of the data we're gathering. So that's the learning forum that we host in Te Hiko. Next slide. So talking about the systems, as you get a sense, it's quite emergent. It doesn't come out of strategic planning. What we find is that we have to start small, and we start with building relationships and growing trust. And out of that is how ideas take root and not all of them take root, and some of them we've got to sort of say, well, that was a good idea, maybe the time's not right, we'll park that. So that diagram there, that's one of our theories of change in Wesley Community Action. And in many respects, that just mirrors what Toby, what you summarised, Toby, in terms of moving from what was the new public management model to the HLS. So our term for the new public management model is a colonising approach. And you'll see all those dot points under there about siloed services, information concentrated in the centre, focus on inputs as opposed to outcomes. So we call that a colonising approach because someone over here knows what's best about how to fix these people in the local community. And our historical experience in this community is that doesn't deliver goods. So the model that we want to sort of transfer to is the term we've used is the rangatira-tanga model, which one of the definitions about that is it just acknowledges the agency and the ability and the capability of local people to be active agents of change. Because we believe that real change happens when the people that are most affected by it are active agents in the change. So we're in this process of trying to move towards that. It looks easy on a diagram, but to be honest, that's really challenging because each of us all actually had, like for myself, I still had parts of the old mindset sort of tucked away, you know, and sometimes I need a bit of a nudge or a boot or something like that to sort of let that go. So that's the systems. Next slide, thanks. And the last slide from me is around the governance and accountability. So what I've just done there as a shot is in the middle there, that's the sort of, if you like, our organisational diagram. And that's centred, first of all, around the people. And that in the middle, that sort of looks like a spark, that's what we call the Māori. And that's the essence or the life force that every human has. So that's absolutely front and centre. And around the Māori are all the different parts, people in the life cycle. You know, mum, dad, babies, children, young people, ancestors. So that's the people. Around that, then is the different locations, the community we work within. And down the bottom, we have the different structures or systems that actually hold and support that. We've got a board, and that because we've come under the Methodist Church, the Hāhiwera Te Reana, we have a Māori part of that and a Tauiwi part, Pākehā and Māori part that oversee that. And we also have a guiding group that we call our Kaupapa Tiriti Ropu, which in New Zealand language, that's about trying to give honour a partnership with Indigenous people and those that came after the signing of our Treaty of Waitangi. And so that's the framework that our tries to shape our governance and hold us to account. So we have a board. We have another initiative, which is Just Change, which is a group of people that give some funding to us, but they also want to learn with us. And I've mentioned the learning forums. So that's a real quick overview about Te Hiko. And now I'm going to, Rowena's going to share a bit, and we might have a bit of a conversation about one of those initiatives, and that's the NZ People. And so, Rowena, I mean, over to you, say a little bit about what NZ People is.
NZ People, so we were created about 8.5 years ago from our founder, Lizzie Macalio. She had an experience with someone that needed to help get off methamphetamine, and she had no idea how to do it, really, and she put her social worker hat on and kind of reached out to doctors and hospitals and 0800 numbers and 0900 numbers and got no response. So she kind of looked after this young lady, and during that time observed how to detox someone off methamphetamine, and thought to herself, well, with me being a social worker, how else is this affecting other people out in our community or around our country? So she put together, threw it out there to everyone to kind of say, hey, does anyone know about methamphetamine? And the response back from that was, it was huge. It was absolutely huge. We had people that were ex-users, now AOD counsellors, to whānau, family affected from loved ones using methamphetamine. So she kind of got really I don't know, overwhelmed by the response from just putting that out there to the universe. And then she created, got these people together and created a walk-in, this little safe space for anyone that was impacted from methamphetamine, a space where they could come and offload with like-minded families and people, which grew into a national kind of movement where other people were reaching out, where they wanted to create walk-ins in their own communities because they related it because of the lack of information around addiction, specifically methamphetamine. There was nothing kind of there. And through the learnings of this, she's seen the huge gap between the system and community. There was this huge gap that we couldn't get any information or support around that. Yeah.
So Rowena, like, why do you think that movement grew so quickly? Because it just did. It took off, eh? Like
it did.
It went around the country, and these walk-ins, these spaces where people could come to the table and share their story or just listen, whatever. What do you think? Why do you think that took off like it did?
I'm not sure if it was just with Lizzie being, she's got a huge heart,
Yeah.
and I think just from her experience, that one moment of experience of not being able to get support, even as a social worker, what's going on with whānau out there or families in the community that haven't even got, a kind of title in there. So she kind of grew from there and throwing it out there to the universe and asking, who knows about this? How do we get support? And I think she created this huge support network, not just only in our community, but across our country. And I think because of that, it was coming from grassroots and lived experience why it kind of went off the scales.
I remember at one stage I talked to a woman who was quite a middle-class professional woman, and she was at her wit's end about knowing how to help her son who had a meth addiction. And she'd heard about this group and she came to it and she said, this is the one place I've been where my voice could be heard and everybody around the table understood her.
Yes.
So there's a lot of shame in this thing.
A lot of shame, a lot of embarrassment, scared. I myself, before being in this role, I was actually one of the people at the table because of what experience I had with methamphetamine, losing my kids' dad to methamphetamine, my children getting hooked on methamphetamine, the way I couldn't get support from the system. There was just nothing there, and this is going back 20 years, and we kind of still feel there is more coming out now in terms of support. But I think when you actually are supporting whānau, where you've actually experienced yourself, whānau or family, because it's all about trust, building that trust and earning that respect and being able to support them and walk along them to create their own journey into recovery. That's how I kind of feel like, because I've got to think about when I was in that spot, I couldn't find anyone to talk to. I didn't know who to talk to. I didn't trust anyone. So I kind of had to use my own experience when I was supporting other family.
So like in terms of enablers there, Rowena, you talked about how like even your own journey from someone who was like finding it really hard and stressed about how to handle it. A whole lot of other people who are now leaders in NZ People have come through a similar journey. So it's like you've built the leadership and capability from the grassroots. Do you want to say a little bit about some of how you've done that, the training and support?
So because of the outreach with Lizzie and her getting other whānau and families contacting us to kind of become part of the movement, it all came together through our experiences, and then we had to kind of think, well, how can we take this any further? When we started getting training from the likes of Peter Thorburn, who is part of...
I remember.
God, it's not that I can't remember. It's a lot. We got a lot of training because even though we had lived experience, we had to learn how to support families on this journey. So by doing all these little trainings, as well as using our own experiences, we started growing. Our team started to grow. We started to learn a lot about not just methamphetamine, it was about addiction, the overall, about addiction. Because if this is growing into what it's going to be, we have to start learning a lot, and we bounced off each other. We had people putting their hands up to come and teach us little things about supervision, our wellness, how do we take care of ourselves was a huge thing for our movement, because obviously you cannot support anyone on an empty cup. So it's taken years and years to get to the stage where we were at when we're in terms of supporting whānau. Yeah.
Oh, thank you. And I just wonder if we just go to the next slide, Jess, there's another slide there. So part of that is education and getting some key messages. And I think linking to what Toby was saying about complexity, I think within a family system, there can be nothing more complex when you've got a family member or someone on meths. All the rules, all their predictability, it just becomes chaos.
Yes.
So it's sort of like, how do you try and deal with that complexity? And how do you try and calm it and stabilize it and just reassure people so that people can move through that chaos into some stability and then create some pathways? And I think the experience of Brian that you talked about, Toby, I think we could do some really parallel sort of stories of people who came in to this movement absolutely spinning, and through just being respected, heard, reassured, given some hints, then actually their demand for services, their chaos calmed down.
Very much so.
Just one more last slide there, Jess. And so that's, about, so there's these local networks in different communities around New Zealand. How many are on the Facebook page?
We have a private Facebook page. We've got over 8,000 members on our page, and we just monitor, our team just monitor that page. We don't own the page, our members own that page. It's a support page where anyone that needs to have information about their family, how do they identify if their family members on meth, and our members are like vultures. We kind of just step back and our members take care of answering questions and supporting.
So it's a really citizen-led process.
Yeah,
so
very much so.
And so just the last slide, and we'll just bring this to a close, Jess. So thanks, Rowena, for giving a taste of that example of NZ People. So these are just some of our initial sort of like top tips, if you like, just reflecting on all this amazing stuff that's emerging and happening. One is that we sort of say it's really important to put the majority of resources towards the people and the local community. Often if you think of a hierarchy, it's at the bottom of the hierarchy, because our experiences in initiatives and co-design and collaborations, there's this bias where the resources tend to shift up the system. So it's really important to try and constantly flip it. Another key learning is food's important. We talk about manaakitanga and hosting people. So there's nothing like having a good kai, having some good food and having conversations with people over food. Really simple, but it's very important. It shows a practical way of helping people. We've also learned that, expect and understand resistance. For some of the stuff that we're talking about, some people, they resist the NZ People, and a lot of naysayers really. And it's not so much, don't get into attack them, just understand them and respect them, and but don't give them a lot of energy, and that's part of the change process. And our last one is, we always want to have fun, and we just want to foster curiosity. If it's not fun and a lot of the thing, then there's not the spark, and somewhere we're losing something. So look, we'll leave it there. Hopefully that gives you a little bit of a taste of some of what's happening under Te Heko. So I'll hand it back to you, Jessica.
Thank you, David. Thank you, Rowena. Really inspiring stuff, and just so remarkable to hear from what on the surface is two really different programs, a governance model and a community-facing model, and to see so much similarity between the work that you're doing just really speaks to the power of HLS to me. So now we are going to open up some breakout rooms and move into that portion of the day. So what we're going to do is we're going to have 3 breakout rooms open. One will be with Toby Lowe, the second one will be with Ruth and Abby from QPSC, and the third breakout room will be with David and Rowena from Te Hiko. So I'll open up those rooms and you'll have the option to join whichever one you like. If you're not in the mood for joining a breakout room, you don't have to. You can hang out in the plenary with me. I'm going to pop a reflective journaling question up on the screen for you to respond to in any way that you wish, if you wish to do some writing, and play some music in the background as well. So while I pull that up, the breakout rooms are now open, so you should now be able to join whichever one you choose. Welcome back, everyone. I'm seeing everyone streaming back in.
Is it gone?
Great. All right. I think.
No.
All right. Looks like we are. Awesome. So I'm going to draw us to an official close before we start our after party. Just an invitation as we're leaving today. Feel welcome to share in the chat any key takeaways or questions that you're still holding. It'd be super interesting for myself and our speakers to have a sense of what you're walking away from today with. And just another reminder that we're stronger together, and building community around this work is really exciting. So if you are on LinkedIn and interested in connecting with others, feel welcome to join that LinkedIn group. I've just dropped another link in the chat to that one. And a reminder as well to download and read through those HLS reports. Really interesting stuff in there that's worth your time. So with that, thank you everyone so much for taking the time to be here today. A big thank you to our speakers, to Toby, to Abby, to Ruth, to David, to Rowena. Really amazing to hear your insights. Really great to have you all here. And with that, I will let those of you who wish to leave the official webinar to do so, and those who want to stick around for the after party, hang out, ask questions. Let's continue the conversation. So I will be quiet and pass to whoever wants to kick off on the after party chat.
Jess, I noticed a couple of people in the comments said that they might like to talk about the items in the Q&A. I'm not sure if they got covered in Toby's breakout room or not, but if people want to hang out and talk about that, we can.
Yeah, I'd see. That's a great point, Ruth. I'm looking at the Q&A now. I see Arthur's questions got quite a few thumbs up. Is that something you were able to cover in your breakout, Toby? Did you want to have, or maybe even share back a bit about what you discussed if you did?
We began to talk about it. So Arthur asked me that kind of question, and I responded. It would be really, excuse me, it'd be really interesting to hear Arthur's kind of response to the thing that the answer that I gave, because we had to move on quite quickly, and just to say a little bit about where that question comes from for you, Arthur.
Yeah, absolutely. So I have a, lifelong skepticism of like metrics and, data-driven decision-making in government as well. And also a lot of respect for the impact evaluation field at the same time, and particularly some of the ways that I think it's been able to be really responsive to these concerns and to think through like, okay, we know that metrics will get gamed. What are ways that we can develop our impact evaluation to account for that, adopting like countervailing metrics so that like if one metric shows signs of being gamed, that's going to show up in another metric. And I, have a lot of understanding and empathy for the idea that it's difficult to isolate the causality and the impact of any given program because we exist in such complex systems. And I think that the best impact evaluation is able to be conscious of that and able to say we never can know a true counterfactual, but with the methodology that we have, this is our best guess at that, and that it can be compatible with this kind of systems thinking because we are able to use it to make better sense of the information, recognizing that we're never able to fully understand it. So I think I feel conflicted, right? Because I both, I'm heartily skeptical of metrics and also admire how I think the field has come a long way. And, I like to imagine there's a future where, impact evaluation, quantitative metrics gathering can be more compatible with this approach, because I think there's, some benefits that could come from sort of a treaty between the two approaches.
Thank you, Arthur. And I'll give a different response to that, because every time we talk about this, the conversation iterates a little bit. So thank you for that reformulation, Arthur. So, because I think I would agree that when people use that kind of data for sense making, then it can be part of like good learning approaches. And because I think the other thing I would say, the different thing I would say, that the response we gave to you in our breakout room is, people get very exercised about what they should measure to understand the impact and those kind of things. And the question what we should measure is important, but it's a secondary question to why are we measuring? Why are we using data? And this is the choice that we have to make. I think that we can either use that kind of measures for performance management to try and control people, or we can use that kind of data for learning. So, if we use that kind of data for learning rather than to try and control people, then absolutely any kind of impact metric or anything can become part of a helpful sense-making conversation. What is going on around here? And in general, the people doing the work know the kind of information that would be useful to them in order to what do they need to know in order to reflect on how to get better at what they're doing. Measure that. Yeah. Use that for learning and improvement. Don't use it to try and control people. So don't make it a promotion and reward dependent on that. Don't make people's contracts dependent on that. If you try and use that data for control, that's when it fails.
I'd be interested in Abby and Ruth's opinion on this too, because you shared a bit about your MEL framework, and I wonder if you have a perspective to offer with regards to Arthur's question.
Abby, do you want to go? Or do you want me to go?
No, you can talk. Go for it.
Well, so I suppose at this stage of the model, I can't even really imagine how we might use. Well, I guess it comes down to the ambition of the model. Like, it would make no sense for us to use measurement really to control, because at this stage we're trying to establish pathways for learning, and so our approach to measurement and evaluation needs to support that. I do think that we'll definitely find there'll be times where we'll come up against questions around that, particularly in terms of that sort of public sector bureaucratic thinking around, what's the value for money here? What are we actually delivering? How do you quantify the value of time taken to learn and time taken to strengthen relationships. Even in terms of impact measurement at this stage, it's kind of beyond really my capacity to think about how we would do this. So we're very much steeped in the learning our way through at this point.
Can I be controversial?
Of course.
It's the after party.
Oh, it's the after party. So this was a question about like Brian, and maybe kind of challenging you a little bit, Tony, but I'm sure there's some like answer. So when I was listening to the story and talking about the gamification of like data, like I kind of couldn't help but think about how you had potentially done a bit of gamifying, and because you had a like a target which was about demonstrating that you had reduced that cost had been reduced, and that sort of talks to the benefit of the approach. So I'm really curious to understand like how you rationalize that.
Yeah, nice. And the I suppose the response I would make to that, and by the way, this is I love the example you were setting here. Sorry, I missed your name.
Oh, Dame. Sorry,
Dame.
And I'm sorry, I just want to. This is not meant to be a gotcha moment as well. I am really curious. Okay, cool.
Like, we should ask hard questions of one another. This is the point, right? That and if the purpose of the different evaluations that I was referencing had been to demonstrate how those relational approaches were cheaper, then exactly we couldn't trust. It will make it more difficult to trust that data because that will put it into the gaming, put it at risk of gaming in exactly all those other things were. But the figures I shared with you were created by organisations who were asking the question, what happened when we did this? So none of they weren't putting decision-making stress on any of those things. If what they had found was that relational approach wasn't helping people and wasn't working that way, they would have changed how they did it. So they weren't they weren't trying to prove that way of working was better. They weren't trying to demonstrate that to anyone. They were asking questions because they wanted to know what the actual answer was. So I think that it escapes that kind of the gaming danger precisely because they were using those measures to learn and improve rather than trying to prove that what they were doing was the best way of doing it.
I suppose as I mentioned in the chat, like I've been doing research for most of my career, and like I hope that that's how most researchers attack things, but you know, we don't always do it. We kind of got the things that that sort of the hierarchy wants us to do these things, and we do the things that they tell us to do. And so, but yes, it's anyway.
And this is the thing that obviously as I'm in one aspect of what I do, I'm a researcher, and it's hard to see the use to which research is put by public managers, and it's understanding that we can make better use of research if we organise around learning rather than organising for control. I think that's this whole approach. It's about liberating us to be able to learn together well, and so that what we're trying to do is effectively create the conditions for learning. And you may well be familiar with the ideal within the current paradigm is that idea of evidence-based policy making, right? So people are that's the holy grail that people are trying to move towards. But the reality that that people find in situations, you may be familiar with this phrase, is policy-based evidence making. And so what we're trying to escape that policy-based evidence making by creating the conditions under which learning can be genuinely used.
Maybe we talk about practice-based evidence.
Yeah. And that there's a beautiful set of ideas around that. I've heard the expression evidence, I think it's a really similar formulation, evidence-informed practice.
Yeah.
And it's at the level of practice is where evidence, I think, is at its most useful. But yeah, we've tended to put evidence into strategic planning processes where we sum up lots of evidence, we aggregate it from different contexts, and we mush it all together as if the differences in context don't matter. Actually, when practitioners, when citizens are able to use evidence and say, as part of their sense-making processes, what is happening around here, that's when it's most useful. I mean, I would love to hear. I was inspired, David, and I don't know if Rowena's still with you, about the learning forums that you were describing and the way that people are trying to make sense of what is happening in your local context. That, to me, I think, is exactly it's an exemplar of what we mean by kind of organising for learning. So I'd love to hear you say more about how you go about those things and how you the evidence in those contexts.
Yeah. I'm happy just to say a brief bit about that. Expand, Toby. It's built on relationships, because the academics in the room were people that we've sort of connected with because of a common interest and value set. So there's the Wellbeing Alliance, Wellbeing Economics. So there's that network. So that was one that we sort of linked with, and people from local government, from the communities where we work, and invited them in. So we're still learning about that, it's still work in progress because we're holding it, and you've got to get to the point of all the stakeholders actually engaging in it and owning the process. So we've been doing it for a couple of years, and some things are sparking, but it takes time, so it is there's some challenges with that, and we find that the process and the facilitation to sort of manage the power dynamics, because often when you get that diversity in the room, some people feel like they're experts and some people feel like what am I doing here? I'm a bit of, what, and so we've sort of got better at the social technology of how to host in a very sort of welcoming and sort of equalizing sort of way. So that's one of the things we've learned is quite important in those forums.
I wonder if I'm seeing, I was just going to actually speak to your question, Adam. I think it's your question about the costs and selling the costs. And I was interested if our speakers had comments on that, but I may have interrupted your response to something. So I'll let you speak, Adam.
Happy to, I was actually going to go somewhere a little bit different, but so then I realized I leave two questions hanging, but I'll throw the one in that I was going to ask, and you can choose which one you must want to go to, perhaps. This is a really different way of working and of people engaging, and I hope my sense is that when people do this, they find it is more human. And David, you mentioned it being fun. So I'm wondering, how kind of sticky and infectious are you finding these ways of working? Because Ruth and Abby, I'm guessing it's pretty different for a lot of the different parts of government you're touching on, different for them. Are people kind of getting involved and saying, this is great, how do we do it? Or are they kind of getting involved saying, oh, this is really, living in two worlds now is really hard? What's the kind of response?
Thanks, Adam. Great question. And this actually came up in our breakout room. I picked up on David and Rowena's tip there about have fun, because it's definitely something I've observed as we've started to work, as we've been working over time with all of these different groups of people, and we've been bringing a different kind of ethos to the way that people convene, and it is more human and it is more relational. And yes, I think that people do legitimately find it more fun and more meaningful. And there's definitely, I mean, we have had people who have been dyed-in-the-wool bureaucrats who have, you know, been really quite uncomfortable at the outset, but who we had one example actually recently of a person who was a very senior sponsor of the model, sort of a second in charge of a large delivery department, who came to us and, you know, at first was really like, what's this delivering? What's it delivering? And then recently sort of made the comment to us that only through this work does she now understand how to sit in ambiguity and how to kind of, you know, work with what's emerging around her. And to us, that was just like, yes, job done. But people do get really engaged, and people come together in a way that is, you know, much more interpersonal and much more connected. And I really do think that people then feel more of a sense of purpose in the work. Yeah. Don't know if Abby, if you have any other thoughts on that.
The only thing I would add as well is there's definitely been an evolution in terms of supporters. We had people, you know, you will all be aware of, you know, there's always early adopters, and then there's a late majority that kind of comes on later. They kind of sit back and watch and a little bit skeptical at first. And so our philosophy was very much work with where the energy is initially. And so we built kind of a cohort. We have a bit of an inside joke of over time we've kind of inducted people into our little cult and brought them on the journey with us. But it takes time, and we have seen in the initial stages kind of felt like it took a little bit to get people on the journey with us. But it's the last kind of 3 months, even 3 to 6 months, we've just seen this groundswell very, very quickly of all of a sudden people are aware, people want to know, people are reaching out to us saying, can you come brief our agency? Can you come brief our team? How do we get involved? It took a long time for us to get to that point. But so, yeah, it evolves over time, the support.
Great question, though. Thank you, Adam.
And just one of the things that I wanted to highlight about what Ruth, the example that Ruth and Abby presented, one of the reasons that I love it is that it shows that it's possible even in large scale bureaucracies. So and I think the amazing work that Ruth and Abby and others in that context are doing is exactly, if you can change how the governance processes for a kind of public service ecosystem work, then it creates enabling conditions that can change a whole bunch of other things. And showing that it's possible to enable people to feel purpose, to feel like they're doing purposeful work in large-scale bureaucracies. It's almost like we should take a moment to recognize how amazing that is, because in some respects it's easier to see that kind of stuff in the context that David and Rowena were talking about, because, you know, in the public-facing working community, people can really see and feel that up close and just like, oh yeah, that's what that looks like. In larger scale bureaucracies, it's hard to do that, and that's why one of the reasons why I love what Ruth and Abby shared with us today.
Can I know I'm talking a lot, I do it a lot, I'm the very verbose, I apologize, but I'm going to just say, like, as a person who's done qualitative and quantitative research and then moved into this space of systemic design and that kind of stuff, like, for me, there's been some real beauty in shifting from the mindset from doing research and like having a focus group and doing a survey into this space of let's co-design and let's build a relationship with the people that we, doing the research with. It feels better. It makes me as an individual feel, as you were saying, much more connected to the things that I'm doing. So yeah.
So much more human and real to be able to lean into the fun and the curiosity. I loved that point when you offered it at the end, David, about having fun. And I've been, as I said before, working a little bit with Ruth and Abby over the past year plus through a learning partnership to help walk alongside them as this model gets implemented. And they were actually really brave in letting us come in and do some really playful, experiential stuff as well. We would come in and bring a whole bunch of stakeholders from the model together, and we would build towers out of spaghetti and marshmallow. We played games, kind of like musical chairs. We did a lot of stuff that is really countercultural in government, but it was really valuable in so many ways because the people outside the room can see the fun that's happening inside these rooms, and it's infectious. And it's not just done flippantly, it's done for a reason. It's done because it creates conditions for learning and reflection and connection and relationship building. And so, yeah, I just think kudos to Abby and Ruth and all of those involved in that model for being open to doing some of that stuff, because it does feel weird, but it is really important to have fun.
It's been fabulous. Did you want to go to your question about costs, Adam?
I guess again, we're kind of working in a space where it seems like a job of trying to convince 1 million people that we've got to do things differently and that there's got to be a different approach. And it's just finding the avenue in for that message to land. And often there is a business case part of that comes up. And yet, despite the amount of evidence there is of the efficacy of spending on early intervention and prevention work, we still don't see budgets shifting in that way. And so, Toby, the kind of numbers you were sharing about what future costs you can prevent, I mean, they're huge numbers. But I'm interested in to what extent that lands and is accepted as kind of real and possible. So yeah, really interested in where making those cases kind of works.
Shall I kind of leap into that? So one of the things that helped was when I was describing that the figures, the national figures for the Changing Futures Northumbria evaluation. So the Changing Futures national programme is a UK government programme. So they had put their own evaluation processes into it. So when these people were generating these figures, it was their own figures that they were that they were talking about, and the figures were so stark that they came to the attention of Treasury, like Whitehall Treasury, and it's like that's like unheard of in this kind of context. And so one of the important things here, I think, is we're not talking. So in general, people tend to make these arguments about the value of preventative services, right? And in the UK at the moment, there's a lot of discussion about left shift, right? So moving, and you will often hear people talk about moving services upstream in relation to this stuff. All of that is true, but it tends to be harder messages, particularly for politicians to hear, because what you're saying is, if you do some unpopular things now, and in 5 years later it will be better. That's not a lot of that's not a message that's a lot of use for a politician, because if saying if you do things that, like, if you do this, what it means is that the people, when you get voted out because you've done a bunch of unpopular things, the people who are following you, they'll get a bunch of benefits from this. So we're specifically, so all of the arguments about prevention are true, but that's not the arguments that we're making. So we're saying you can make cost savings right away, just by simply liberating and moving to a liberating and learning public management approach rather than a control and compliance approach. So right now, in 12 months' time, you will be able to see the effects on demand for public service if you make this kind of switch. And look, here's all the evidence, and showing the Treasury folks how much money is being wasted because of the siloed approach of new public management, because of the effects of targets. That's the crucial thing, and that cost saving stuff can happen within a financial year or within a meaningful political time horizon, right? So we're specifically not trying to make the argument in the context of prevention, although it's important to say all of those arguments are right. What we're saying is it is simply by reframing your current services as and thinking about the concept of failure demand, because what we're really talking about here is failure demand. Our current approach to public service bakes in failure, so that when public service interacts with people, it doesn't sort out their issues, it doesn't respond to their strengths, doesn't meet their needs, so they keep coming back. That's why we have the waste that we do, because the public service isn't designed to respond to the whole complexity of people's lives. And that's the kind of straightforward argument we can make with these kind of figures. If you meet someone's needs first time by responding to their whole complexity of people's lives, it is so much more resource efficient. Look, ta-da! That is, in those contexts, that evidence I think is hero.
Yeah, that's really useful.
Your hand's up,
Okay,
Abby.
I'm going to do it because there's a silence. I'm going to do it. I'm going to talk some more. Sorry. No, this time it's a question. And I'm really curious about this this idea, because like it's kind of a binary. Like we've got control and compliance, and then we've got liberation down the other end, and they're like at the it's this binary kind of thing. So is there space for blends of the two? And maybe we're already doing that, but like, what are your thoughts on that? Is it a binary or is there fusions?
I mean, I have thoughts on that, but people have heard enough of my voice, so.
Look, I guess from the perspective of the model and the work that we do, Damien, is that it's like a nudging towards. It's not one or the other, but it's a nudging towards. And I think, these things will have to coexist at least for a time, right? I don't know.
Yeah, and I would probably just add to that, we can't change in its entirety the system that we're working within. The system is what it is, and there is a reality to how it operates. And so what we've attempted to do with the model is, within the confines of that system, create a space where life can look a little different, but still operate within the existing system. So there are still reporting templates, and there are still agendas in meetings, and there are still minutes. And so in that sense, we are still responding to the control and comply environment. But outside of those pieces, there are additional mechanisms where we can be learning, adaptive, agile, playing, have a bit of fun. So we're not ignoring the current system. In fact, I think if we had ignored it, we would not have gotten as far as we've gotten. So it's working within as much as possible. I was also just going to give an example in response to your question, Adam, too, about costs and how to make that argument. I can speak to a piece of work that we've encountered. I won't name the piece of work. I'll talk in broad terms, but we have had a government-wide policy that's been rolled out across all agencies, and it affects large numbers of public servants. The policy was written by a central agency in an urbanised location, and without, I think you could say, appropriate consultation with regional public servants to truly understand how that policy might impact them in regional areas. And in practice, what has happened is the policy in a general sense just doesn't work very well in regional areas. And in fact, it makes life more challenging for some public servants to do their job. So now, and these regional public servants have for a long time attempted to kind of explain the consequences within their own leadership and management and reporting lines, but haven't had a lot of success. And so what the model allows us to do is create a direct pathway from regional public servants into centre of government leadership. Interestingly, even with that pathway established, when we explained the issue to government leaders, they were unaware of what was happening on the ground and how the policy in practice was affecting people. And so we've been able to really lay that out very clearly. And the realisation now is that the policy as implemented has actually led to a lot of unnecessary costs that could have been avoided if regional voice had been sought in the policy development stages. Now, we haven't solved the issue yet. And so we haven't necessarily saved costs up front, but what we have definitely been able to do is demonstrate that costs could have been saved. If we had have taken the liberated and learning approach and consulted people, we maybe could have avoided some of the issues we're now experiencing.
I have another question. Oh, sorry.
Could I just pick up on your question,
sorry, yes.
Jamie, about whether the two things, kind of liberating learning and control and comply, can whether it is a binary or not? So I think there are two different ways to answer that question. We've heard a little bit of those. Is so that in practice in the world, those two things are bound, like particularly in that as things change between the kind of paradigms, you are bound to have those situations that Abby and Ruth are describing, where the two different organizing principles kind of rub up against each other and are part of the same world. So in the realities of public management situations, you will find those two principles operating simultaneously, and they have to find ways to rub along next to each other. So the practice of it, absolutely, those two things can live side by side. But it's also important to understand that conceptually they are in tension. So you can either organise for control, or you can organise for liberation conceptually. And so what you can't do is purposefully say, we are going to organise this bit for control and this bit for liberation. Because what you do then is you create, if you have something that tries to mash those principles together, you get an incoherent mess that doesn't work. So for example, if leaders are giving messages to people saying, we want you to liberate and learn, but they're still trying to control people through their performance management mechanisms, then people will hear the message from the leaders and go, you don't really mean that, because you're not enacting that thoroughly by changing the way that my performance reviews work and changing my possibilities for promotion. So you have to, the opportunity here is producing an alternative whole that works that puts those liberation and learn principles through everything, through what leaders say, through how leaders organise, through how performance management works, through blah, 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 through how our commissioning process works. It is when we run those principles through everything that we genuinely get the alternative paradigm, and it creates a coherent story of change. And that's what I think the real possibility around this is when leaders can say, look, we trust you. we trust you because you know your job's better than I can possibly know your job as a leader. And then can work that story of liberation provides a set of a context in which anyone can then think, oh yeah, I can understand and see my place in that. So there's something really, really important about telling a coherent story about how the world can be different, and then enabling people to kind of populate that with it. And you can't tell that coherent story if you're trying to mash together the principles from different paradigms.
And that seems to bring us right back to the start of what you talked about, with a shift from believing that people are selfish and not to be trusted to a belief that people are capable and can be trusted, which seems like a pretty big narrative that we need to find a way to shift.
Exactly. Yeah, you've heard enough from me.
I'll break the silence. I'm going to do it. I suppose the binary that was kind of like that came through a little bit there in some of the conversations as well was like this sort of binary between like lived experience and the expert. And I suppose it's kind of like the difference between telling a story and data, maybe. I'm curious to hear what you think about that binary and how that interplays. Any thoughts?
I could chime in here and talk a little bit about how we're approaching that dynamic in our measurement, evaluation and learning plan. So we are obviously collecting data as part of our measurement of the effectiveness of the model. But data in isolation doesn't necessarily capture the full context or complexity or nuance of what's actually occurring. So how we've attempted to kind of manage those two is capture data, yes, but then take an approach where we will pull together stakeholders once we've collected that data from all over the model and put them in a room and have them collectively make sense of that data and ask each other questions about, well, what does that number mean? And why is that number low? And is there an explanation for that? And actually collectively make sense of it and try and understand the story behind the data itself, as opposed to reviewing the data, making a set of assumptions and then responding. We collectively make sense of the data together and then collectively come up with potentially a range of responses, but only once everyone's kind of heard from all the various players and understood the full story behind the data.
And that, picking up on Abby's point there, if you treat that kind of people's experience in their own lives and in some way kind of aggregated research data as two different types of knowledge that you can use for sense making purposes, then both can play their roles, because both those types of knowledge have strengths and weaknesses in enabling you to people to understand what is happening here, and like why what has happened is the thing that has happened. So treating either one of those things as having primacy feels like a mistake. Putting all of that stuff on the table and saying all of this experience, all of this knowledge is valuable, what sense do we make of it? That feels like then people can understand the strengths and weaknesses of those different forms of knowledge and make what sense of it they will.
Thanks, Toby. Folks, I'm really sorry. Sorry. Who did I cut off then?
No, I was just going to say, hey, it's getting late for especially Elizabeth in Australia. So I was going to say I'm going to drop off, and I just wanted to say thank you to all of you. But sorry, Ruth.
No, I have a persistent something in my eye, and it's just getting worse. So I'm going to go and bathe it properly. But this has been a really lovely chat. Thank you so much. And thanks for sticking around.
Ain't no party like a human learning systems after party.
I wonder if
Jess.
yeah, thanks, Ruth. Thanks, Adam. I wonder if on that note we should just bring it to a bit of a close. It's been so wonderful. I really appreciate everyone sticking around for the after party. And we should let everyone, I guess, get to their days and their evenings.
Thank you so much. Thanks, everybody.
Bye.
Thanks, Jess. Everyone.
Have a good day or night.